becoming a pharmacist? Okay, maybe we'll change your mind, but we do have candy, so we'll just pass it around. You guys can take some. It's probably not the most most popular thing to pass around, but take whatever you want. All right, we'll go ahead and get started.
Alrighty, so as Kelsey mentioned, both of us are pharmacists right now with Billings Clinic, which is obviously right here in Billings, Montana. You guys are probably fairly familiar with Billings Clinic, but just because we're both from there, we wanted to tell you a little bit more specifically about the pharmacy side of things at Billings Clinic. What you guys might not know about Billings Clinic is that it is almost a 300-bed hospital, which is a pretty darn good size. So Kelsey and I in the pharmacy department specifically, we get to deal with a lot of things that smaller hospitals don't have. And we'll touch on some of that during our talk a little bit. Of note, Billings Clinic does have about almost 4,000 full-time employees that work there. The pharmacy department is just a tiny, tiny fraction of that, and we'll talk about that a little bit as well.
All right, so what about our pharmacy department? So within the pharmacy department at Billings Clinic, we have tons of different types of clinical pharmacists. So we have inpatient pharmacists, outpatient, long-term care, ambulatory care. We also, within Billings Clinic, have an anticoagulation clinic. We have an infusion center. And then the other two parts that are kind of fun is that we have the internal medicine resident program, which is more of the medical residents. We take part in that program. So we have a pharmacist that rounds every day with all of the internal medicine residents, and it just gives us an opportunity to interact with them and really just provide medication management when they're rounding on their patients. So most of our employees at Billings Clinic, they either have a bachelor's of pharmacy, they have their pharmacy doctorate, and then, so those are the two things. Back in the old day, all you needed to be a pharmacist was a bachelor of pharmacy. But I think in 2001, that requirement changed, and now you need your pharmacy doctorate. So most people that are in the younger era have their pharmacy doctorate. The only pharmacy school in Montana is in Missoula. That's where I graduated from. And then once you graduate from school, you go on to do what's called a residency. So just like with medical students, they go to medical school, they graduate from medical school, and they go into a residency program. Their residency is required, but the thing about pharmacy is that our residency is not required. There will probably be some movements moving towards requiring a residency if you want to work in a hospital, but both Megan did her residency last year at Billings Clinic, and I'm currently in my PGY1 residency. PGY2 residencies are more for pharmacists who want to specialize in a specific area. So sometimes people will specialize in pediatrics, oncology, infectious disease, critical care, but PGY2s are really focused on specializing in a certain area. And then lastly, board certification allows pharmacists to become board certified as a clinical pharmacist. So most of the time, when you see a hospital pharmacist, they're doing more clinical activities than just what you might think of your average pharmacist behind the counter at CVS. So when you think of a pharmacist in a hospital, we're really engaged with the interdisciplinary healthcare team caring for patients. And the board certification allows you to really show that you have the knowledge to care for patients in the hospital. It's kind of how we like to think of it.
And so I'll just expand on some of that a little bit. Like I said, our pharmacy department is just a tiny, tiny portion of the 3,800 people that Billings Clinic employs. We have about 52 pharmacists that work there right now. Of those 52 pharmacists, 18 of them have a postgraduate year 1 or PGY1 residency under their belt, and only 5 of them have a second year residency that they've undergone, so that's PGY2. But of that 52, almost half of them, so about 21 of our pharmacists are actually board certified. And the other things that I just wanted to touch on, so I don't know how well kind of familiar you guys are with the healthcare field, but how many people know what ambulatory care is? Excellent. Would you like to volunteer a definition?
Well, isn't it just like helping people walk?
And that's what a lot of people absolutely think. So, and that's the kind of root word that we want you looking for. So those are people that are walking into the clinic. So ambulatory care pharmacist actually sits up in the internal medicine clinic at the hospital and sees patients who are coming in as outpatients. They're not sick enough to be admitted. They get to work with a lot of different disease states. So chronic COPD management, chronic diabetes management. So they're able to build potentially a lot deeper relationship with those patients than like Kelsey or I. We both work on the inpatient side. So when our patients come in, they're, deathly ill. We're trying to get them well enough to go home and live on their own again. We don't really get to build really good relationships with them. So that is one thing if you're interested in kind of building those relationships and having that ongoing impact in somebody's life, the ambulatory care clinic is definitely something to look into. Our infusion center mostly works with patients who maybe have cancer and they need to go in and get chemotherapy infusions. They also manage like nausea for those patients, so they have a whole protocol that they can work with those patients to keep some of those symptoms under control. And let's see, the pain management is kind of self-explanatory. Our internal medicine, like Kelsey mentioned, is that kind of clinic. They work on the inpatient and outpatient side though. So they have the internal medicine residents, but then they also have the internal medicine faculty who all see patients. And again, those are doctors that are working kind of on that more chronic disease state management. But they'll see patients that have a COPD exacerbation that get admitted to the hospital as well. So in the hospital, we kind of get to see all sides of the patient, and that's part of why I really enjoy being at Billings Clinic. So we wanted to get you guys to kind of guess a little bit at what our job might entail. So feel free to just shout out responses here.
I can hear the
Yeah, and Kelsey will hand out more candy because you always need more candy. So I'll explain a little bit. So pharmacists are one of the few medical professions that we kind of have to prove our worth. So every day that I go into work, I have to keep a tally sheet of how many clinical interventions I do. So if I call the doctor to get a medication change because a patient has an allergy and the medication could potentially kill them even, or cause them some form of harm, I can tally that down and I have to take a certain amount of time for that. We also manage protocols with patients, so we do dosing specifically for a lot of antibiotics, vancomycin, aminoglycosides. I won't go too in depth with that for you guys. We also do anticoagulation management. So basically pharmacists have their fingers in a lot of places. So on average, how many hours do you think the full pharmacy department, so potentially 52 pharmacists, might log with making clinical interventions for patients? Throw out any number you think. 80 hours a month for 52 pharmacists. Excellent. Okay.
Oh my.
Good. So per pharmacist, let's say that might be about 1,000 hours or 4,000 hours. Yeah, so that seems reasonable. Any other guesses? I'll tell you it's lower than that number.
65.
65 hours each. So that's about 3,500 hours maybe a month. A little bit lower
I'm bad
than
at
that.
math in my head. I'm really bad at math.
Sorry. You've got all these systems. 20 hours, that's probably about right. So it works out to 2,200 hours of the whole department logs every month for clinical intervention. So if you think about that, we are going to work on that. If you think about that, that's quite a bit of time that we put into just that kind of direct patient interaction. So that's not including the time that we're spending, doing some of the more traditional dispensing roles you might think of for a pharmacist. So like packaging medications or verifying the work that our technicians are doing, things like that. So how many inpatient medication orders, which is equivalent to like an outpatient prescription, do you guys think we process through the pharmacy in one day?
And as an example, each patient probably has average of 8 medications, 6 to 8 medications, and that's kind of low for most hospitalizations. And we have to verify each and every one of those medications. So how many do you think we do per day? Just verifying orders.
Higher.
Like 600.
Higher than 6,000. I heard 1,000. Higher than 1,000. Ooh, I heard 2,000 and 1,500. Higher than both of those.
6,000.
Excellent. You guys are overestimating now, which I appreciate. So we do about 3,000 a day. And if you think about that, on an average day at Billings Clinic, we have probably 12 pharmacists on staff at the very most. So those 12 pharmacists are checking 3,000 prescriptions every single day to make sure that they're not going to interact with any other medications the patient's taking, that they're not going to interact with any disease states that a patient has, that they're not going to interact with any allergies that patient has, and that essentially those are like the most clinically effective medications that we can offer the patient. So that's just a snippet of what we do every day. So keeping that in mind, that we do 3,000 new prescription orders processed every day, how many doses do you think we dispense in the hospital per year?
You want this.
I don't know, million.
Excellent guess. A little bit higher than that, actually.
1.29.
Very, very close. We'll go with excellent. 1.3 million doses that we dispense from the pharmacy every year. So, again, I can't really stress how busy we are in the pharmacy. And then finally, we do have the outpatient pharmacy that's associated with Billings Clinic. So they're up on the atrium. You guys may have seen them when you've been there with friends or family or yourself. So they also act as a full dispensing pharmacy, just like you would see at CVS or Walmart. They do have a limited scope, so they can only serve employees or patients who need like a emergency supply of medication. So you couldn't just go in there and say, hey, I want my prescription filled because I'm not happy with the service I'm getting at CVS or something like that. So how many prescriptions do you guys think that they fill per month? And I'll just do 2 guesses on this one. I heard a math whisper over there.
300.
300?
Try that a day.
Yeah, or like not quite that many. We do about 8,000 prescriptions up there. And there again, the outpatient pharmacist is doing all of those same checks that we're doing on the inpatient side. I personally think the outpatient pharmacists are at a little bit of a disadvantage because if I have an issue with a new order that gets written, a lot of the times I can call a floor pharmacist who can go meet with that physician face to face, or I can just call up the physician myself directly. It's a lot harder for the outpatient pharmacist to be able to jump in and make those interventions. Because you can imagine when you call to make an appointment with your doctor, how hard it is to get in touch with them sometimes. So certainly I think we're lucky on the inpatient side that we have a little bit easier access, basically.
All right, so the biggest question is, what do we do? And Megan has touched on this a little bit, but I will let her fast forward. Oh,
Sorry.
so our friends think that we roll in money and pharmacists make a lot of money, which residents do not, FYI. Your mom thinks that you maybe just check medications. Parents think that just relax at work. Technicians think that you're always on your phone, pharmacy technicians. But what we really do is our jobs are to make sure that medication therapy that patients get, whether it's in the hospital or outside of the hospital, is the most appropriate thing for the patient. So when you go to pharmacy school, you're trained to know how to treat disease states. Doctors are trained to diagnose disease states. We are trained to treat disease states. So really, I think that's what makes our jobs the most enjoyable, is that you're always learning because you don't know everything about a disease state, but you also really get to make a lot of interventions because healthcare is so complicated anymore, and physicians, it takes time for them to learn about how to treat disease states. So we're really there to just help them make some of those good medication therapy choices when they're providing therapy to their patients. Oh, yeah, just because of money things up there. So we talked about residency. So when you're in your first year residency, we make about an average of $40,000 a year out of school. Compared to some of our retail friends, they make roughly $120,000 a year graduating from pharmacy school. In terms of a clinical pharmacist salary, I don't even know what the starting wage are.
So after residency last year, I started out right around $100,000 for the year. So that's obviously lower than what the retail pharmacists make. Retail pharmacy is a huge industry and there's definitely opportunity there. But I personally like my hours. So to kind of highlight the difference between a resident and a pharmacist a little bit more. So like Kelsey said, you get paid about $40,000 a year, which would work out to about like $19.80, I think, an hour if you were to break it down for a 40-hour work week. But the whole point of residency is that you're doing an intensive year of extra training. I would say on average last year as a resident, I probably worked 90 to 120 hours every week.
Yeah, I'm like in the average of like 80 to 100 hours a week as a resident. And once again, I only get paid for 40 hours a week. So it is a downside when you are in a residency, but they say that 1 year of residency is equivalent to 3-ish years of being in practice. So I'm at the hospital for a lot of hours, and I'm doing projects and all of that, but I'm gaining a ton of experience. So they kind of just jam-pack everything into your PGY1 year. And a lot of the day, like the main part of your day as a resident, you'll spend time rounding, you'll get time to work up patients, do protocols, all of that. But then those extra hours that come in are because we do research, we do quality improvement projects for the hospital. There's tons of projects that we do, but those are where the extra hours come into play. As a pharmacist, it's really nice to work in a clinical setting because a lot of times you're going to work 4/10s, so you're going to work 4 days on, 3 days off. Or like Megan's position, right now she works 7 days on and 7 days off. So she essentially works half of a year, which is really nice. Those 7 days on can be long, depending on what's going on. But the bonus about hospital pharmacy and clinical pharmacy is that you really have those options to kind of mix and match with your schedule instead of just 8 to 5 Monday through Friday. So that's the part that I like about clinical pharmacy. And let's see. The other part that I think we'll touch on, well, I think we'll touch on it in a minute, the roles. Yeah. All right, so Megan and I just wanted to tell you guys a little bit about us and how we got to where we are today. So I am originally from Chinook, Montana. Your mom was my counselor in school, Miss Maz. And also go Sugar Beaters, if anybody knows about Chinook. I did my pre-pharmacy coursework at MSU Billings, and then after that I transferred to Missoula and did all of my pharmacy school there. Something interesting is that I started working at a pharmacy in high school. I was like the delivery girl / janitor in high school, and that's where I really started to develop this interest for pharmacy. And I knew I wanted to do something in the healthcare field, but I had took some like CNA classes and that really wasn't my thing. And one of our good family friends was a pharmacist and she said, I think you should really pursue this. So after high school, I got my technician license, and all during my pre-pharmacy school, as well as when I was in pharmacy school, I worked as a technician. So I worked at Juros Pharmacy here in town during my undergrad. And then I also worked at a retail pharmacy in Missoula. And then the biggest part, and what gave me interest in hospital pharmacy, is I worked at Billings Clinic on my winter breaks and on summer breaks. So that's where I started to develop all of these interests. Like I worked in the IV room, I was able to go on the floors, I shadowed some pharmacists, and that's where I really knew that I liked that fast-paced, more acute care, dealing with patients in that realm of pharmacy. So obviously I graduated last year, started residency at Billings Clinic in June, and I have 79 days left. So
It's really exciting.
yeah. So the best advice that I received when I was in college was you need to find something that you're passionate about. So right now I spend a lot of my life at the hospital. If I didn't love what I was doing, I would hate my life. So the biggest thing that you need to do is find something that you're passionate about and that you love going to work for every day, because you will spend more time at your job than you do with your family. So just keep that in mind. What do I like best? I love being in residency. I love being in pharmacy because we really have a chance to work with people. We get a chance to work with physicians, nurses, respiratory therapists, physical therapists, but we get a chance to work with patients. When we're rounding on patients, we get to talk to them about their medications, what problems they're having, and then in the same realm of things, we get to help solve those problems. So there's a ton of problem solving associated with our jobs. And that kind of goes along with the making saves and catching errors. It's a really, really rewarding feeling when you can know that you prevented a patient from harm. So whether it's something small or something big, all of those really help with job satisfaction. Lastly, probably my biggest thing is, these kind of go along the lines, but I love being in a fast-paced environment. So I really enjoy critical care. I love the emergency department. And then I also like infectious disease. And all of these areas, there's a lot of opportunity for teaching within those. And I've really found that I enjoy that. I enjoy, whether it's I'm teaching a patient or helping one of the nurses, that's just something that I'm really passionate about. So that's kind of how I got to this point in my life. And if you guys have questions too, Megan and I can give you our emails and we can help answer questions. But I'll let Megan go.
So I'm Megan Saunders. I am currently what's called a clinical pharmacist 1, so I'm kind of the lowest level of clinical pharmacist at this point in time, because I just got hired on about a year ago at the clinic. I'm from Chinook, Washington, which I think we thought was really entertaining that we're both from Chinook, just in different states. I was actually born in California. I won't go too much into my backstory. Moved around a lot. Part of that time was spent in Colorado, which I'll get to in a little bit. I was a lot less focused and had no idea what I wanted to do with my life when I was in high school. I just knew I needed to get to college, and then when I got to college, I knew I really liked science, so I wanted to do something with biology, so I declared a general biology degree. During that time, I liked a lot of different TV shows, and that generally narrated what I thought I might want to do with my life. Because that's logical. So for quite a while, I wanted to be a lawyer because I really liked Ally McBeal. That obviously had gone away. I really enjoyed CSI when that was popular, so I wanted to be a crime scene investigator, but back in Washington, there's 2 for the whole state, so that obviously wasn't going to happen. So I ended up declaring a dual degree, essentially, in biology and anthropology, because I love science and people. And then I found out it was only 2 extra classes I had to take to get a minor in chemistry, so I went ahead and did that. Turned out working out really well for me, because I basically graduated with my undergrad degree. I was working at Old Navy and BioLife Plasma Services, if you guys have ever heard of it. It's a plasma donation place. Both of those you need a high school diploma to work at, so I was like, I'm not really using my degree, what can I do to change this? Talked to a friend of mine who, again, was like, oh, hey, you should look into pharmacy because you like science and people, and both of those things are involved in pharmacy. So, long story short, kind of a wing and a prayer, I ended up moving from Washington out to Wyoming because it was kind of close to Colorado where I had lived for a little while. I studied for a month and took the pharmacy college aptitude test, or the PCAT, which is what you have to take and get a certain score on to be able to qualify to go to pharmacy school. And I took my test, did pretty all right on it, thank goodness, because my degree really came in handy there. And I ended up applying just to the University of Wyoming, because I didn't have money to move anywhere else at that point. So I had all my eggs in that basket, and ended up getting accepted, obviously went through school and was successful in getting my degree, and met the director of pharmacy up here at Billings Clinic and his wife, who is the residency director. Both of them just happen to be UW graduates, so that's kind of the story for how I ended up here for my interview. I don't know, how many of you guys have been inside Billings Clinic at all? Just about everybody. Excellent. So I walked into that place for my interview and I was in awe. That hospital is beautiful compared to most hospitals you go to. And the pharmacy services that we provide there are, like I said, just they blow most other places I have been to for interviews out of the water. We just have such great relationships with the providers and many, many, many things that I could go on and on and on about for why I ended up staying there. But I finished my residency, thankfully, back in June of last year. and then started in July in my current role. So like Kelsey said, I work 7 days on and I have 7 days off. That's not like 7, 8-hour shifts. I work 11.5-hour shifts, and they kind of are terrible sometimes. And that's if I leave on time. Most of the time I do not. I work 10:30 a.m. until 10 p.m. A lot of the time I don't leave until 10:30 or 11, but that's just me. Otherwise though, I really, really enjoy it. The best advice that I think I received when I was in college was just really not to pigeonhole myself. I have always kind of been that person that wanted many, many options. I was kind of a commitment phobe, I guess you could say. So that's part of why the PharmD really appealed to me, because you can do just about anything you would want to do with this degree. We have a brand new manager that we just hired at the pharmacy who went straight from school, did 2 years of residency, and now they're in a management position. So he's not really going to be doing clinical things with his degree. You could go work at a retail pharmacy. I could have gone into academia and be a lecturer, which I would really like to do at some point in time when I have a little bit more experience under my belt to be able to, give some good, I guess, pass on good experiences to the class. But yeah, so that's part of why I ended up going with the PharmD, was just because I felt I had so many options with that degree. I won't go too much into what I like best about the career. I did talk a lot about the options for change. I really love those interpersonal interactions. There are a few physicians at the hospital who, when they call down to the main pharmacy where I work, they'll ask for me specifically. That's a really, really good feeling when that happens, because it does not happen often. So it's very nice. But yeah, that's pretty much me in a nutshell. I think we'll probably try to go through some of these other slides fairly quickly, just to make sure that you guys have time for questions at the end if you have any.
We touched on this briefly, but this is kind of the history of pharmacy, but before it was a profession of trial and error. So they really didn't know what worked, and they had to just try things and see if they worked. Now we have a ton of branches of service within pharmacy. All the medications and therapies that we provide are based on evidence and trials that have been researched. And like Megan said, there's tons of things that you can do. You can do research, nuclear pharmacy, retail pharmacy, hospital pharmacy, ambulatory care, blah, 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 blah. I think we've told you a ton of the different options, so the options are endless.
So this will just be some different pictures that will show about different ideas or opportunities you have for different pharmacy careers. So this fellow is using a mortar and pestle and essentially doing some sort of compounding. So we actually do this in the hospital fairly frequently. We'll grind up pills to make a solution if somebody can't swallow pills. We make a lot of lotions. We make different medicated creams and ointments for the most part. And yeah, otherwise, like I said, just crushing up tablets and making them into a solution if you need them. This is more of kind of compounding. She's using a scale here just to weigh out her product and be accurate there. This is maybe some of what you guys might picture more with pharmacists on the outpatient or retail side. So counting medications, that's, all of us do so much more than that, but that's probably one of the common things that you might think about. This is also, I believe, a pharmacy technician, so that is absolutely another option that you guys have as far as a career path in pharmacy. Our technicians, a lot of them do go through, I think it's a 1-year course to be a pharmacy technician, and you can actually get like a degree, as opposed to some of our technicians who are kind of trained on site and then they go and take an exam to be a tech by certification. So
Techs make like
something, I know it's like 14, depending on where you work. I know as a technician you can make anywhere from like $14 to $19 an hour. So certainly an option for a lot less schooling than you would have to do to be a pharmacist. This is just some of our team actually at Billings Clinic. So this is our pharmacy director and his wife. They went to the University of Wyoming. This is our clinical coordinator. Clark works in purchasing for us to make sure that we have all the medications that we need for our patients. Jake is actually an informaticist pharmacist. So that's kind of an interesting role. He essentially works with the computer systems to try to see what he can do to make it pull the most possible information that we can get. So when I go to verify medication, the computer can tell me if that patient has an allergy. They can tell me different things about various lab results the patient might have had recently. So that's kind of his role. So he mostly just works with computers. But Jake does have his pharmacy doctorate. He was a clinical pharmacist in a more active role for quite a while. So that's certainly another option. And then Amy is our outpatient manager at Billings Clinic. Oh, and then here's our retail pharmacist that you guys might be, again, more familiar with, getting to chat with patients and counsel a mom picking up a prescription for her child. And then I believe I picked this one as a academia pharmacist, so being a lecturer and teaching at like a school of pharmacy. So we've kind of touched on this quite a bit, so we'll just breeze over it. A little bit about pharmacy within the hospital. As Kelsey mentioned, she worked in the IV room for quite a while, so we do have a sterile room in the back of the pharmacy where technicians fully garb up. They have to wear, you can see in the picture, a gown, gloves, a face mask, a hairnet. You can't see their booties, but they do also have booties on to make sure that those medications are prepared as safely as possible. These are doctors and pharmacists and probably nurse, maybe RT, respiratory therapist rounding on patients. Down in the main pharmacy, I feel like I mostly just answer the phone a lot and answer questions that nurses or physicians might have about medications. And then we do have quite a bit of automation in the hospital as well. So if you're into technology, pharmacy is certainly an area that would be moving forward with a lot of different technologies in the future.
All right, so if you do want to be in pharmacy, what do you need to take right now? So the biggest thing is science and math. Biology, anatomy and physiology, chemistry, physics, and mathematics. But the biggest thing is that if you really are interested in pharmacy, you need to contact or search online which schools that you might be interested in applying to, because based on your classes that you have here at Rocky, certain ones will be transferable to the pharmacy school. So I did all my undergrad at MSUB, and I had to take certain classes that were matched to the ones that I would need in Missoula. Really, a lot of pharmacy schools are requiring a minimum of 2 years of prerequisites. Some are even requiring a bachelor's degree before you apply. So it just depends on the program. Another thing that I wanted to touch on is pharmacy school is usually 4 years. So once you get your undergrad degree or do your prerequisites, then you also have 4 more years of pharmacy school. There are some expedited schools that are 3 years. One of them's in California, I think Washington or Oregon has one. So those are 3 years, but they go all year round. So there's options out there for you. Some traits that you might want to have, I think a lot of these are applicable to any healthcare field or any job really, but the biggest thing is you need to have sound judgment, be dependable, really have high ethical and moral standards, be able to communicate and pay attention to details. Also just having passion for what you're doing. If you're going to be a pharmacist, we want you to love your job. So don't go into it just for the money, go into it because you're going to love what you do. We need professionalism, leadership, knowledge, kindness and compassion and humility, and just someone who is going to be there for the best interests of your patients. So.
And with that, I think that is it.
Yeah, we try to save some time so we can answer questions for you guys about what you may have. I can give out more candy if you guys want to ask questions. And really, I mean, this can apply to anything in the healthcare setting too. Since we are really involved in the hospital, we have a lot of information about various roles. So,
How much did you enjoy?
me personally, I mean, okay, so I enjoyed it, but at the same time, I honestly, I did it so that I could get to here. And the thing is that you need to take all of your undergrad classes seriously because you're not going to get to this point unless you do. So in that sense, I took my classes seriously, but was it my favorite thing? Maybe not, but at the same time, like, it didn't change how much I love my job either. Does that make sense?
Mm-hmm.
Chemistry and me were not really good friends. Like I did pretty okay, probably in intro chemistry, but did up through OChem, and I think I got not A's in OChem. Yeah. Okay. Like, and in our role as pharmacists, like Kelsey and I are not trying to make new drugs. We're not trying to make new molecules. And so the extent that we need to understand it is pretty much to be able to look at, let's say an antibiotic, for example. So cephalosporins, there's like 5 different tiers of cephalosporins. Certain ones in different classes have different side chains that might make a person more likely to have an allergy to one than another. That's about the extent of the understanding of chemistry that we need to really have at this point in time. So,
Or like binding, some drugs because of their molecular shapes, like have a tendency to bind to one another and cause interactions. But
yeah, it doesn't play a big role, I don't think, in day-to-day unless if you're going to research. So if you're not a big fan of chemistry, it is not something that should shy away from pharmacy.
But if you love chemistry, there's tons of options. Like, I have 2 classmates that went into fellowships for just research, and they graduated from U of M, and they just really were good at chemistry, they loved it, and they kind of just like that bench work and research work. So, really good question. What else can I answer for you guys? Did we change anybody's mind? Like, slightly?
Give your candy.
Well, I think we might just share a couple stories then. We've told you guys a lot about kind of our day-to-day lives, but a couple of things that I thought was really cool as a pharmacist that I would not have gotten exposed to if I didn't go into pharmacy. We get to respond to codes. So if a patient is in critical condition, or if their heart is not beating, or if they're not breathing, or if they're a level 1 trauma coming into the facility, pharmacists respond to those. I've been to some amazing codes where I've seen some things that, like 10 years ago, I probably would have thought would make me faint. And I've been able to go and watch open heart surgeries, and that is like an amazing thing to be able to see the human body working like that. I won't go into too much detail unless anybody really wants me to. But one of the coolest things I think that I have ever gotten to be involved with was actually we have a NICU, so neonatal intensive care unit at the hospital. Our babies, the youngest I think that we've had since I've been there was 26 weeks gestation. A normal gestation period for a human infant is 40 weeks. 32 is considered like a term baby. So you can imagine 26 weeks is not very far along. Yeah, like 4 sticks of butter is about what you can imagine. So like a pound, a 1 kilogram baby would be like 2.2 pounds. So that's what, 9 sticks of butter, I think. So that was one of the coolest things I got to go to was we had a 1 kilogram baby that was coming out. Very, very premature. At that point, baby's lungs are not developed. Everything else is actually not in too bad a shape at that point. And so one of the coolest things I got to be involved with was being with our NICU pharmacist as he was preparing the artificial surfactants that we give to baby to help their lungs open and expand and help them breathe a little bit better. So we actually got to be in the room when baby was born. We got a specific weight for baby. The pharmacist began drawing up the doses, and then the nurses over there administering it. And CuraSurf is what it's called, or Peractant. It's kind of an interesting medication. So they'll essentially put it down a tube into the lungs, and they'll give half the dose, and then they'll rock the baby onto one side, and then kind of tilt them around to get it smushed around all in their lungs. And then they'll rock over to the other side, give the other half of the dose, and they kind of roll the baby around to get it moved around in their lungs. So, yeah, so we do get to do some really, I thought that was really amazing to be able to see that, and then eventually see baby go home, so.
I was just sitting here thinking, probably my favorite part, just because I do like the fast-paced stuff, is a lot of the traumas. But one of the codes that stands out the most in my mind is I was doing a rotation in the emergency department, and we had somebody come in that had been coding. They were found at their home. A bystander was performing CPR, and then the EMS team brought them in, still doing CPR. And for somebody to code outside of the hospital, the chance of them surviving is very, very low. So already when patients are coming in, we're kind of like, okay, look, we're going to do the best that we can, but in your mind you have to be prepared that these patients may not make it. So we started going through the CPR process, and this was one of the CPRs where I'm finally able to do things more independently, and we were able to, we did about 4 rounds of CPR and gave quite a few medications, but eventually that patient ended up getting a pulse back, getting their heartbeat back, and started breathing, but by then we had to intubate them or put a tube down their throat to help them breathe. And it was almost like an epiphany to me, like, we make a difference. And it was just something that'll always stick out in my mind, whether it's because that patient actually survived and in my mind I didn't have good hopes. It made me just realize that we really do make a difference, and we have to treat every patient like we're going to help them. And it was just a really cool experience for me, and I think that's just one of the many. Megan and I, one of my very first traumas that I responded to was as a student last year with Megan. It was the first time I'd ever seen somebody pass away, and it was very, very emotional for me. But now I'm at the point where I've kind of learned a lot of those processes, and I've been able to process those emotions. And it was, being in pharmacy, I never thought that I was going to have to process so many emotions. But even now, it just kind of chokes me up a little bit, because you deal with patients and their families on a day-to-day basis, and their lives are in your hands. And that's something that's really, really amazing to me. That's all we have for you guys, unless you guys have any questions, but we appreciate it.
Alright, assignment for next week is to pretend you just got your doctorate of pharmacy and you are going out to do whatever you're going to do. Tell me about why you would choose whatever route you choose, whether you go to pharmacy research, you go into academia, you go work at Walgreens, you go work at the Billings Clinic. Pick one that you think would best fit your lifestyle and tell me why.